Mfs Plus is a physician-formulated product specially formulated for male universal fertility. Specifically, Mfs Plus has been designed for male factor infertility involving the combination of low sperm count, decreased sperm motility, and abnormal sperm morphology. Mfs Plus is also indicated in cases of unexplained or idiopathic infertility, which is usually associated with elevated DNA fragmentation index. Finally, Mfs Plus has a special ingredient called Relora that causes relaxation without sedation, which is important in resolving premature ejaculation. Briefly, the following are the normal semen parameters which determine fertility. In terms of numbers, the sperm concentration or count should be at least 15 million spermatozoa per milliliter. Total sperm number per ejaculate should be at least 39 million spermatozoa. Total semen volume per ejaculate should be at least 1.5 millimeter, and the pH should be 7.2 or greater. In terms of motility, the total motility, that is the percentage of progressive motility and non-progressive motility, should be at least 40% or at least 32% of progressive motility. In terms of morphology, that is the percentage of normal sperm forms, there should be at least 4% spermatozoa of normal forms. Finally, the vitality or spermatozoa that are alive should be at least 58%. Mfs Plus is indicated in the following conditions. 1. Patients with normal hormonal assay but with abnormal seminal fluid analysis. 2. Triple defect cases or oligoadenoteratozospermia, which is cases where both the sperm count, sperm motility, and sperm morphology are abnormal. And lastly, idiopathic or unexplained infertility with normal semen analysis but associated with the elevated DNA fragmentation index. The following are the ingredients of Mfs Plus. Relora, which is a patented ingredient, acetyl L-carnitine, coenzyme Q10, glutathione, vitamin A, vitamin C, vitamin E, vitamin B2, vitamin B3, folic acid, vitamin B12, zinc, selenium, L-methionine, and lycopene. The combination of these ingredients is based on evidence-based logic, which is informed by evidence from scientific literature. And Mfs Plus is a unique product because of two reasons. 1, it contains Relora, which is a proprietary ingredient, and 2, it has a proprietary blending that is exclusive to MS, where the constitution and concentration of several ingredients is unique to AMS Mfs Plus. Mfs Plus has the following benefits. It improves sperm motility, it increases sperm count, it enhances sperm morphology, and it increases elevated DNA fragmentation index, which is associated with idiopathic or unexplained infertility. Apart from having a super antioxidant blend, Relora in Mfs Plus causes relaxation without sedation, and this is important in resolving premature ejaculation. Mfs Plus has two categories of ingredients. The first category is Relora, which is a special proprietary ingredient, while the second category consists of a superoxidant blend and multivitamins. Now we'll talk about Relora, which is the key ingredient in Mfs Plus. First, Relora is a blend of two plant extracts, Pherodendron amurens and Magnolia officinalis. Second, Relora is a proprietary blend which is patented in the US. Finally, Relora is approved by Dietary Supplement Health and Education, which is regulated by the FDA. This slide summarizes the history of Relora. Traditionally, Relora is known for its tremendous potential for weight loss and managing stress. Specifically, Magnolia officinalis has been widely used in Chinese medicine for its neuroprotective and relaxation properties. On the other hand, Pherodendron amurens has been widely used in Chinese medicine to manage several conditions including osteoarthritis, excess weight, diarrhea, and stomach ulcers. Several reasons informed inclusion of Relora in Mfs Plus, as highlighted in the following studies. The first study demonstrated that obesity negatively affects male reproductive potential by not only reducing the sperm count, but also altering the physical and molecular structure of germ cells and mature sperm. The second study demonstrated that adiposity and weight gain in general are associated with low ejaculate volume, low semen concentration, and low total sperm count. The third study investigated the effects of stress on semen parameters. Diagram A illustrates the relationship between sperm count and stress, and it shows that sperm concentration is negatively associated with stress levels. Diagram B illustrates the relationship between sperm motility and stress, and it shows that the percentage of motile sperm is negatively associated with stress levels. Finally, Diagram C illustrates the relationship between sperm morphology and stress, and it shows that the percentage of morphologically normal sperm is negatively associated with stress levels. Relora exerts its effects through reducing cortisol levels, which mediates the effects of stress on semen parameters. This slide summarizes results from a study that investigated the effects of stress hormone on men's reproductive function. As shown, stress increases the levels of glucocorticoid concentrations, which inhibit testosterone biosynthesis, leading to decreased testosterone secretion. On the other hand, high corticosterone concentrations increases the frequency of apoptosis of Leydig cells, thereby increasing their rates of dying, further decreasing testosterone and androgen production. This slide summarizes the mechanism of action of Relora. Relora alleviates stress and stress-related eating by decreasing cortisol levels. Relora binds in CNS with chemical receptors other than benzodiazepine, relieving stress without causing sedation. Specifically, Relora decreases cortisol levels and peripheral sympathetic tone by activating noradrenaline catabolism and depressing its release by preventing rise of intracellular calcium ions. The net result is a feeling of relaxation without sedation. Studies have shown that chronic stress is associated with increased cortisol levels and decreased DHEA levels. Administration of Relora has been shown to significantly increase DHEA levels by up to 227% and to significantly decrease cortisol levels by 37% and eventually return them to their normal levels. Another trial showed that administration of Relora helps in controlling stress-related symptoms such as irritability, emotional ups and downs, restlessness, tense muscles, poor sleep, and increased appetite. Stress management is important because stress profoundly suppresses male reproductive system and reduces sperm count and fecundity. In contrast, the study showed that resolution of stress results in dramatically high mortal sperm numbers. This is another study on Relora, and it was a double-blind, placebo-controlled clinical trial that investigated the effects of Relora on weight management in overweight premenopausal women with high anxiety and a tendency to eat more in response to stress. All subjects completed the study, and Relora was well tolerated. Results showed that Relora group had no significant weight gain, but in fact had some weight loss compared to the placebo group. There was also significant reduction in anxiety scores and lower cortisol levels in Relora group compared to the placebo group, which had high anxiety scores and elevated cortisol levels. The conclusion from the study was that the mechanism of action appeared to be through reduction of stress, hormone levels, and perceived stress, thereby helping the subjects maintain body weight. This is another study, a randomized, double-blind, placebo-controlled study on the effects of Relora on cortisol and psychological mood state in moderately stressed individuals. Subjects were given 250 mg of Relora thrice a day for 4 weeks. Specifically, the study explored the effects of Relora supplementation on cortisol, mood, and overall stress levels. As shown in this diagram, results showed significant reduction of cortisol in the Relora group compared to the placebo group. This further suggested that the mechanism of action of Relora appears to be through the reduction or normalization of stress. Relora is highly tolerable. For example, toxicity studies have shown that up to 5 grams per kilogram of Relora is gentle on the stomach and safe with no unwanted side effects except mild diarrhea. Mfs Plus has a moderate dose of Relora at 250 mg, so it is safe. In the US, Relora is used for weight loss that is associated with stress and stress-related condition known as metabolic syndrome. Relora controls the adrenal gland, leading to a decrease in cortisol levels and increase in DHEA, and ultimately an increase in testosterone. This section will cover the effects of oxidative stress on spermatozoa and the role of antioxidants in reproduction. This study examined the role of oxidative stress and antioxidants in male fertility. This diagram summarizes factors that produce reactive oxygen species that causes oxidative stress. Factors such as environmental pollution, infection, lifestyle, and occupational factors leads to an increase in reactive oxygen species. An increase in reactive oxygen species relative to antioxidants causes oxidative stress, which causes sperm damage through affecting the DNA, protein, and lipid constituents, resulting in decreased sperm numbers and disturbed sperm function. This affects motility, viability, capacitation, and acrosome reaction. The study showed that spermatozoa are particularly vulnerable to the harmful effects of reactive oxygen species and oxidative stress, which affects their activity, damage their DNA structure, and accelerates apoptosis or death. This study investigated factors that produce reactive oxygen species, including physiological factors such as cellular metabolism and environmental and lifestyle factors such as smoking and infection. Excess production of reactive oxygen species leads to an imbalance between oxidants and antioxidants, resulting in oxidative stress. Oxidative stress will affect sperm in the following ways: sperm DNA fragmentation, cross-linking chromosomal abnormalities, messenger DNA damage, impaired fertilization causing infertility and recurrent abortions, genetic diseases and childhood malignancies, reduced sperm motility, and sperm membrane lipid peroxidation. This study summarized the crucial roles of antioxidants in semen. Semen consists of both enzymatic and non-enzymatic antioxidants that protect the sperm from oxidative damage. These antioxidants closely interact with each other to ensure optimal protection against reactive oxygen species, and studies have shown that deficiency of any of these antioxidants can cause a decrease in total antioxidant status. Studies have also demonstrated that many antioxidants possess beneficial effects on fertility. Non-enzymatic antioxidants include vitamin A, vitamin E, vitamin C, vitamin B complex, glutathione, pantothenic acid, coenzyme Q10, carnitine, zinc, selenium, and copper. This study examined the effect of oral antioxidant treatment on the dynamics of sperm DNA fragmentation in subpopulation with highly degraded sperm DNA. The primary objective was to determine the effect of L-carnitine, vitamin C, coenzyme Q10, vitamin E, zinc, vitamin B9, selenium, and vitamin B12 on the dynamics of DNA fragmentation in infertile men diagnosed with adenoteratospermia. The second objective was to use the sperm chromatin dispersion test to study antioxidant effects on a specific subpopulation of highly DNA-degraded sperm. Finally, overall semen parameters and pregnancy rates were also determined. The results were as follows. 1. There was significant improvement of DNA integrity at all incubation points. Second, there was significant reduction in the proportion of DNA-degraded sperm. Finally, semen analysis data showed a significant increase in concentration, motility, vitality, and morphology parameters. This is a systematic review of clinical trials on effects of oral antioxidants on basic semen and other parameters in idiopathic oligoadenoteratospermia. The review involved controlled and randomized clinical studies published between January 2000 and December 2013. The majority of studies confirmed beneficial effects of different antioxidants on at least one of the semen parameters, and the biggest effect was found on sperm motility. The review revealed that most trials used combination of more than one antioxidant, and the most common antioxidants studied were vitamin E, vitamin C, selenium, coenzyme Q10, N-acetylcysteine, L-carnitine, and zinc. This table shows why a carefully selected blend of antioxidants is important, because different antioxidants have unique effects on various semen parameters. For example, coenzyme Q10 has positive effect on triple defect cases, sperm count, sperm motility, and sperm morphology, but no effect on DNA fragmentation. Vitamin E has an effect on triple defect cases, sperm count, sperm motility, and DNA fragmentation, but no effect on sperm morphology. Selenium has an effect on triple defect cases, sperm motility, sperm morphology, DNA fragmentation, but no effect on sperm count. Vitamin C has a very important role in maintaining DNA integrity and decreasing DNA fragmentation, but no pronounced effect on sperm count, motility, or morphology, but it has benefits in idiopathic triple defect cases. N-acetylcysteine has a general effect on idiopathic or unexplained infertility, but no pronounced effect on other parameters. Finally, zinc has an effect on DNA fragmentation, and the combination of vitamin C and E has the most favorable effects on DNA fragmentation. In conclusion, antioxidants play an important role in protecting semen from reactive oxygen species and can improve basic sperm parameters in cases of idiopathic oligoadenoteratospermia or triple defect cases. This is another review on studies done to investigate the effects of antioxidant supplementation on semen parameters. It has been established that approximately 30 to 80% of infertility cases are caused by oxidative stress and decreased level of total antioxidant capacity. This table summarizes effects of coenzyme Q10, vitamin E, and carnitine antioxidants. Coenzyme Q10 and vitamin E have beneficial effects on sperm count and in decreasing DNA damage, while carnitine has effects on sperm motility and sperm morphology. This is an important study on the effects of antioxidants on DNA fragmentation index. Despite it not being routinely tested when assessing infertility patients, DNA fragmentation index is a very important parameter to take into consideration, because whenever it is more than 25 to 30%, there is a very high risk for infertility in a man. Currently, there is no well-established treatment for high DNA fragmentation index, but many references recommend taking antioxidants to resolve it. This study demonstrated that treatment of men with a DNA fragmentation index greater than 30% with a 30 to 90-day course of antioxidants was associated with significantly decreased DNA fragmentation index. This study investigated the effects of selenium and vitamin E supplementation on semen parameters and pregnancy rates in infertile men. The study consisted of a 14-day treatment phase, with all patients required to cease all medication therapy 6 weeks before the study. This table contains results from the study. In summary, there was improvements in sperm motility and sperm morphology and increased rates of spontaneous pregnancies in subjects who took combination of selenium and vitamin E. As seen earlier, antioxidants are extremely important for male fertility, and they work best in specific combinations. Glutathione is a master antioxidant and has synergistic effect with selenium. Glutathione reduces their oxidative damage by neutralizing the harmful effects of free radicals, but its concentration in maturing spermatozoa declines during spermatogenesis. The concentration of the thio-antioxidant system, which includes glutathione, is 10 times more in the seminal fluid than it is in plasma, and this indicates how significant it is in spermatogenesis and in reducing DNA damage. This study evaluated the impact of trace elements and glutathione levels on semen quality of Tunisian infertile men. The study revealed an association between seminal zinc, selenium, and glutathione with increased risk for sperm abnormalities, low sperm quality, and idiopathic infertility. Results from the study recommended routine determination of antioxidant status during infertility investigation. L-carnitine is another important ingredient for semen quality. First, as shown in this study, L-carnitine plays an important role in cellular energy production as it is necessary for mitochondrial oxidation of long-chain fatty acids. Carnitine also protects the cell membrane and DNA from free radicals damage. In fact, due to its significance to semen quality, the highest concentration of L-carnitine is found in epididymal fluid, where its concentration is around 2,000 times higher than in circulating blood. Studies have shown that initiation of sperm motility occurs in parallel to an increase in carnitine concentration in the epididymal lumen and acetyl L-carnitine in spermatozoa. Due to their actions and functions, L-carnitine and acetyl L-carnitine have been proposed and used to treat selected forms of oligoadenoteratozoospermia or triple defect cases. In fact, studies have demonstrated beneficial effects of L-carnitine and acetyl L-carnitine in male infertility. For example, this study, which was a double-blind placebo-controlled study, showed that infertile men with poor semen quality showed improvements in sperm concentration, sperm motility, sperm morphology, and increased pregnancy rates after L-carnitine and acetyl L-carnitine administration. Studies, for example, publication milestones in medicine, have shown that positive effects of L-carnitine and acetyl L-carnitine on sperm quality are observed at least 2 months after use, which is consistent with the 74-day sperm maturation cycle. On the other hand, maximum improvements in sperm quality should be expected after 6 months of therapy. This study used light and electron microscopy to evaluate the effects of L-carnitine on sperm morphology among subfertile men. The subjects were classified into 4 groups, depending on specific semen profile as shown. For example, Group 1 had 10 normal fertile men, Group 2 had 25 oligozoospermic cases with sperm count less than 20 million per milliliter. Group 3 had 25 adenozoospermic cases with reduced sperm motility less than 40%, and Group 4 had 25 teratozoospermic cases with more than 40% abnormal forms. L-carnitine was given for 3 months to Groups 2, 3, and 4, while Group 1 served as control. These images are for the healthy group. Figure 1 is a photomicrograph of normal sperm from healthy fertile men. Figure 2 is an electron photomicrograph of longitudinal section of normal sperm of healthy group. It is displaying normal organization of the nucleus N and acrosome A. It is also showing normal head, normal acrosome, normal midpiece, and normal tail. These images are for teratozoospermic group before and after treatment with L-carnitine. The first image before treatment shows hypoplasia, small head label H, abnormal acrosome label A, and sphericity of the nucleus label N. The second image is a longitudinal section after treatment showing normal head label H, normal nuclear pattern label N, and normal arrangement of the mitochondrial structure of the midpiece labeled MP. These images are from the adenosospermic group before and after treatment with L-carnitine. The first image is of longitudinal section before treatment, showing abnormal rounded head labeled H, degenerated acrosome labeled A, big cytoplasmic droplet labeled CD, and abnormal axonal structure labeled AS. The second image is of longitudinal section after treatment, displaying normal midpiece labeled MP and regular microtubule doublets of the axoneme labeled MDA. These images are from the oligosospermic group before and after treatment with L-carnitine. The first image is of longitudinal section before treatment, displaying malformed acrosome labeled A, a thin midpiece labeled MP with defected mitochondria labeled M. The second image is of longitudinal section after treatment, demonstrating normal head labeled H, normal acrosome cap labeled A, and well-defined tail labeled T. In summary, the study demonstrated that carnitine also improves sperm morphology besides its well-known effect on improving sperm motility. L-methionine is another important ingredient in Mfs Plus. Methionine is one of the 8 essential amino acids, and it is used in the formation of sperm membrane and overall sperm structure. Methionine is also a powerful antioxidant that protects against damage from free radicals and also helps the body to eliminate fats. Methionine is also useful in the treatment of premature ejaculation, and it is also useful in treating chronic depression. Finally, methionine increases sperm count and helps to improve sperm motility. Lycopene is a well-known antioxidant usually present in products indicated for men, and it protects against lipid and DNA oxidation. Lycopene is usually found in high levels in seminal fluid and is also used for treatment of idiopathic infertility caused by poor quality of sperm. In addition, lycopene has been shown in one of the Harvard University studies to reduce the risk of prostate cancer and heart diseases. This study showed that lycopene improves the distorted ratio between arachidonic acid and docosahexaenoic acid and increases the likelihood of successful pregnancy. Arachidonic acid is one of the oxidants or free radicals, while docosahexaenoic acid is an antioxidant. Studies have shown that distorted ratio of arachidonic acid and docosahexaenoic acid is associated with men with idiopathic infertility. In the study, subjects were subdivided into 21 normosospermic males from couples with idiopathic infertility and 23 males with semen abnormalities. Prior to the treatment with lycopene, the arachidonic acid to docosahexaenoic acid ratios in both subgroups were significantly higher than in the fertile controls. The study demonstrated that lycopene treatment restored the normal ratio of arachidonic acid to docosahexaenoic acid and resolved the oxidative stress. In the study, 7 spontaneous pregnancies, or 16%, occurred before the scheduled IVF treatment, and 42% of couples achieved pregnancy after IVF. The conclusion of the study was that 3 months of treatment with the lycopene led to a significant improvement in the arachidonic acid to docosahexaenoic acid ratio in seminal plasma of infertile couples and facilitated the spontaneous as well as IVF conception. This section will cover coenzyme Q10. Coenzyme Q10 is a very well-known antioxidant and is used for cardiovascular health. This study evaluated the efficacy of coenzyme Q10 on semen parameters, pump function, and reproductive hormones in infertile men. The study involved 212 infertile men with idiopathic oligoathenoteratospermia, that is triple defect cases. Group 1 was given 300 mg of coenzyme Q10 per day, while Group 2 received placebo. Results were as follows. First, there was significant improvements in sperm density and motility in the coenzyme Q10 group. Second, there was an increased percentage of normal sperm forms using the Kruger classification sperm morphology evaluation. Third, a positive correlation was found between treatment duration and sperm count, sperm motility, and sperm morphology. Finally, there was significant decrease in serum FSH and LH at the 26-week treatment phase. In summary, coenzyme Q10 supplementation resulted in statistically significant improvements in sperm and semen parameters, especially sperm count and sperm motility. This study investigated the effects of coenzyme Q10 on oxidative stress in seminal plasma and semen parameters in infertile men with oligoathenoteratospermia, that is triple defect cases. After 3 months of coenzyme Q10 supplementation, there was reduction of oxidative stress in seminal plasma, improvements in semen parameters, and improvement in antioxidant enzyme activity. This graph illustrates the improvement in sperm concentration, forward motility, and total motility. This is another study on ubiquinol, the active form of coenzyme Q10, and it investigated coenzyme Q10 effects on semen parameters in oligoathenoteratospermic patients. The study was a double-blind, placebo-controlled, randomized study, and it involved 228 infertile men with idiopathic oligoteratospermia. Group 1 was given ubiquinol, while Group 2 was given placebo. The results show that coenzyme Q10 improved sperm density, sperm motility, and sperm morphology in infertile men with idiopathic oligoteratospermia. Again, this table shows the effect of coenzyme Q10 on semen parameters and indicates that it improves sperm count, sperm motility, and sperm morphology. Azoospermia, a condition where there is no sperm in the ejaculate, is a difficult case to manage. This study investigated the efficacy of multivitamins treatment on azoospermic patients with maturation arrest. A total of 35 phasospermic patients showing maturation arrest on testicular biopsy were recruited in the study. The patients were divided into two groups, one group without any treatment and another group receiving multivitamins, micronutrients, and coenzyme Q10. The results showed reduction in liquefaction time and relative viscosity on the semen in the treated group. Further, there was appearance of spermatozoa, 4 million per milliliter, about 7% exhibiting progressive motility, and about 6% normal forms, even in the first follow-up visit. The sperm count, sperm motility, and percentage of normal forms increased significantly on subsequent visits. Within 3 months, 2 pregnancies were reported. These observations indicate that multivitamins and micronutrient supplementation improves the qualitative and quantitative parameters of seminogram in patients with azoospermia of maturation arrest. Despite this, management of azoospermic patients remains complex, and we restrict ourselves to cases of low sperm count, low sperm motility, and abnormal sperm morphology. The recommended dose of Mfs Plus is 4 capsules divided into 2 doses per day, preferably after meals. Recommended duration of treatment is a minimum of 3 months, which corresponds to the duration of spermatogenesis. Semen analysis should be done at baseline, and after 3 months, then results compared for improvements in sperm count, sperm motility, and sperm morphology. If DNA fragmentation is considered, this can also be compared. Mfs Plus should be taken together with sperm count max or motility max for more critical benefits. Research has showed that pH affects sperm motility and capacitation, and this publication is one example. In the study, purified sperms from healthy individuals were suspended in sperm nutrition solution of pH 5.2, 6.2, 7.2, and 8.2 and incubated for 15, 30, 60, 90, and 120 minutes respectively. Results showed that 1. Sperm total motility and progressive motility were similar in pH 7.2 and 8.2 but decreased in pH 5.2 and 6.2 solutions. 2. The viability of sperms was decreased in acidic environments. 3. Acidic environments reduced calcium ions during human sperm capacitation. 4. Sperm penetration decreased in acidic environments. Finally, sperm sodium-potassium ATPase activity decreased in acidic environments. In conclusion, the study found that slightly alkaline conditions seemed to stimulate human sperm motility and capacitation. Mfs Plus and Motility Max will provide your patient with all nutrition and supplements that are essential to ensure an optimal pH environment